Welcome back. We continue our conversation about the restoration rights for trans people in healthcare. And to help us understand how the unequal access to medical services has impacted our communities, we have Tanya Walker joining the conversation. She is the co-founder of the New York Transgender Advocacy Group, and she's co-chair at Equality New York. Welcome to the show. Tanya, what's your take on today's announcement by the Biden administration?
I think it's a wonderful announcement. Transgender people will now be able to access health care without being discriminated against by hospital staff. I mean, if you go to the doctor and you're bleeding from a gunshot wound or a knife wound, and the doctor is there or the nurse, and they say, because of my religion, I cannot treat you, then that person, trans person could die. So I think that it makes us feel a little safer going to the doctor and accessing health care with the insurances that we have. I'm a U.S. Army veteran, and I was in the hospital. I was being treated for lung cancer. And I was treated very badly by the staff, and I wasn't given medications, and no one would clean my room, and no one would clean me.
Wow.
I had to clean myself. So it's a great announcement. I'm sure it's going to save lives tonight.
The Human Rights Campaign filed a lawsuit in 2019 on your behalf against the U.S. Department of Health and Human Services. They were challenging, effectively, anti-trans, Trump-era policies. What can you tell us about how you came to work with HRC?
I was working for New York Transgender Advocacy Group, the organization I co-founded, and I began to do stakeholder meetings at the governor's office here in Manhattan, in New York City, and I met Jason Starr, and I met Alfonso David. Alfonso David was leading the meeting, and it had different LGBT groups and organization leaders from around the city and state. We'd convene in a meeting, and we would discuss different bills and just moving the whole community towards equality. That's basically what we were discussing. And I happened to meet Jason Starr. Jason Starr is a lawyer. He and I spoke on the phone for like 3 hours one day, and he was asking about questions about healthcare, being a Black trans woman in healthcare. And I started explaining to him exactly what happened to me at this hospital here in New York City that I really don't want to name. It's a cancer hospital. And I was, I told him how I was treated. And being an Army veteran, he was really actively listening to what I was saying. And then a few days later or a week later, I was involved in a lawsuit against the Trump administration. That was the best thing that, had happened to me, because, mainly the main people affected by the Trump policies are usually Black trans women and trans women of color, or BIPOC, Black people, Black indigenous people of color. So we're the ones that are always suffering. I mean, I think more than 20 girls were killed, Black, girls were killed this year. And it was mainly Black trans women. So whenever a policy came out of Washington, another Black trans woman was killed, or 2 or 3 Black trans women were killed. And so,
Absolutely. Absolutely. Let me just jump in real quick. I didn't mean to. I know, just as you were saying Black Lives Matter, it's like, yeah, all Black Lives Matter, and that certainly includes Black trans lives, and I think that's part of why the numbers are so stark. I mean, a 2015 survey by the National Center for Transgender Equality discovered that more than a third of respondents who saw a healthcare provider had a negative experience. When you look at the numbers for Black and brown people, it gets multiplied. And for Black trans women in particular, we see just extraordinarily bad numbers. Your story, your awful experience that's leading to this lawsuit is not an anomaly. It's not an outlier. This is something that happens every day. These are experiences that you share, but also that many people share, no?
Yes, and it's still happening. Doctors are not taught about trans cultural sensitivity or cultural humility trainings when they're in school, and therefore, when they meet us in person, they get our gender pronouns wrong. They don't know how to deal with a trans person. I mean, we've been here since the beginning of time. I mean, now we have an identity and a politically correct name that they call us transgender people, and we're visible now, and it seems like since we're visible, they're killing more and more trans women. We're the main targets of all of the right is hatred. I mean, they're raising money off of attacking transgender children. They're talking about searching the genitalia of children to make sure that they are cisgender children. They're doing all kinds of things against the trans community, and it mainly hurts Black trans women of color who don't have access to large amounts of money, who don't have access to a higher education degrees, who don't have, who are usually unemployed, due to their transgender status and their race, and without a lot of community support, faith community support, the Black faith community, we need support from them as well. And we need them to understand that we've been here since the beginning of time, and we need their help. We need their help.
Absolutely. Absolutely. Just let me jump in 1 second. We only have about 30 seconds left, but I know another obstacle that trans people often face is having surgeries being considered cosmetic and having their coverage by health care providers denied. When you think about moving forward, I'm assuming that issue's on the table. What are some things you'd like to see moving forward, corrected or changed to really move closer toward equality than even today's announcement will?
What are some things I would like to see? I would like to see doctors, and nurses get educated about us. And if you don't want to care for the transgender community, don't go into the medical field. We need more social workers. We need more folks, more allies. We need more people involved. We need money. We need everything right now. And I would also like to see the Equality Act passed. The Equality Act would solve a lot of our problems when it comes to employment, when it comes to locating low income and affordable housing, when it comes to any legal issues we may have, or credit issues. I think that the Equality Act is so inclusive. If the Equality Act was passed today, you would see less Black transgender women being murdered and less Black trans women having to be forced into survival sex work just to survive today.
Wow.
The Equality Act is really
the Equality Act. The Equality Act is essential. The work we saw done today, the political progress we saw today from the Biden administration simply restores what was already there. What you're talking about is really moving the ball forward and creating a more inclusive and more fair more democratic space for everybody, but especially trans people. And hopefully we see that work done. Tanya, you're part of that work. I want to thank you for your advocacy. And I want to thank you for all your time spent here with BNT and all around the world, really advocating for trans lives. If you want to learn more about Tanya's work with the New York Transgender Advocacy Group, go to www.nytag.org.